This is convened by React Africa Network. Over the next 2 hours, we will explore how we can make AMR MNE systems more robust, harmonized, and One Health aligned. Please introduce yourself in the chat. We would love to see where everyone is joining from. Also, please note that the speaker bios will be pinned to the chat. With that, let's get started. It is now my pleasure to invite Professor Mirfin Mupuntu, Executive Director and co-founder of React Africa, to share his opening remarks and set the stage for today's conversation. Thank you all for joining. Professor Mupuntu, over to you.
Thank you so much, Sherin, and thank you for the participants and all the presenters for joining this important webinar. Dear colleagues who are joining us from across Africa and around the world, it is an honor to welcome you today on behalf of React Africa to this important regional dialogue on strengthening monitoring and evaluation for AMR national action plans in Africa, and particularly at this critical moment as the world prepares for the revised Global Action Plan on AMR, which is expected to be adopted at the World Health Assembly in 2026. Nearly 10 years ago, the Global Action Plan called on all countries to develop and implement multi-sectoral national action plans to address antimicrobial resistance using a One Health approach. And Africa has responded. Today, all member states in the WHO Afro region have developed AMR national action plans. Many have established coordinating structures, launched surveillance programs, and demonstrated strong political will. We should acknowledge these milestones with pride, but we must be realistic as well. Our progress in implementation, in financing, and tracking impact has not matched our progress in planning. Without reliable evidence, we cannot demonstrate what works, what doesn't, or a way to allocate our limited resources. Without strong monitoring and evaluation systems, even the best written national action plans remains intentions rather than instruments of change. The existing data tells us the low and middle income countries continue to struggle with access to healthcare, antibiotic stockouts, weak diagnostic capacity, fragmented data systems, and poor interoperability and weak linkages between surveillance and policy decisions. Besides domestic budget allocation for NAPs is low, especially in African contexts, these challenges do not indicate a lack of interest. They indicate a lack of support, investment, and system readiness. And this is why we are here today. This webinar is not just another conversation on AMR, it is a strategic engagement to ensure that Africa's context, needs, and challenges, especially with measuring, highlighting the outcomes and impacts, should guide the revised global action plans, AMR M&D architecture, not as an afterthought, but as a foundation. We aim to answer the following quick key questions. How do we ensure accountability without overburdening already stretched health systems? How do we transform surveillance and data into policy, influence, and finance arguments? And importantly, how do we unlock domestic and international resources for M&D so that it becomes a priority? Today, we will hear from intergovernmental organizations, global experts, regional actors, national implementers, and financing partners. We will learn from real experiences, real constraints, and real innovation that is happening across Africa. We will also explore how we collectively can develop a regional roadmap for M&D capacity strengthening anchored on collaboration rather than duplication. So as we begin, I encourage openness, practicality, and ambition. Let our discussions today move us one step closer to actually transforming the regional AMR agenda through robust M&D strategies. Thank you, and I look forward to a productive and inspiring session. Thank you.
Thank you, Professor Mopunto, for setting the tone so powerfully and reminding us why MNE remains the foundation for AMR action. We will now move on to our keynote segment. Our first keynote will be by Professor uh, CEO Onyembuchi Chukwu. Professor Chukwu is a member of One Health Global Leaders Group on AMR. He is a former Minister of Health, Nigeria, and Professor of Orthopedic Surgery at Alex Ekwueme Federal University in Nigeria. He will be speaking on significance of MNE in strengthening accountability and governance for AMR NAPS. The floor is yours, Professor Chukwu.
Thank you very much, Sharon. Hello to everyone, every participant. I'm speaking from Abuja, Nigeria, and I'm here on behalf of the Global Leaders Group on MR, the GLG. Greetings from the GLG. Thank you, React Africa, for inviting me to be part of this very, very key webinar. And I think this is a beautiful prelude to the WOW, the World MR Awareness Week, which comes up next week. I've been requested to speak on strengthening M&E monitoring and evaluation capacity for effective implementation of MR national action plans in Africa. And like the introductory remarks clearly stated, the whole idea of setting targets, setting goals, is to be able to monitor and to be able to measure them. If we cannot measure them, then the targets obviously may not likely be achieved. Presently, there are many platforms already existing for M&E as far as MR is concerned globally. Many of us are aware of GLASS. You remember GLASS by the WHO, which is the Global Antimicrobial Resistance and Use Surveillance System that was floated by the World Health Organization. And then, of course, the other partners, the FAO, Food and Agriculture Organization, has the INFARM, FARM, F-A-R-M, which is the International Food and Agriculture Organization Antimicrobial Resistance Monitoring System. And I'm sure we're also aware about Animus. Animus is being hosted by the World Organization for Animal Health, which is the global database on animal antimicrobial use. But then all these groups came together along with the United Nations Environmental Program. We call them the quadripartite team, a very important team for the MR, speaking to One Health. And now we have what is now known as the TRACS, the global database for tracking MR country self-assessment survey. So we have more than enough, but if we're talking about strengthening, without going into details yet, I'm proposing that definitely the world ministers who have been meeting for some years under the high-level ministerial meeting on antimicrobial resistance, of which the next one is being planned for next year and will be hosted by Nigeria here in Abuja. I'm proposing that they should have a peer review mechanism, a kind of dashboard where they can critique themselves as peers, monitor each other's progress, suggest ways progress can be accelerated. And I think that those are more than enough. So good afternoon, everyone, distinguished colleagues, partners, and friends. As I join you at this important webinar, we need to reflect on the urgency and collective responsibility we share in advancing antimicrobial control across our continent. As you are aware, the WOW theme for this year's celebration is Act Now. We need to act now to protect our present and to secure our future. This is a critical dialogue for one, accountability, for two, transparency, and then of course for governance in delivering the various national action plans for AMR. We'll recall that at the UNGAS of 2024, world leaders endorsed the political declaration reaffirming AMR as a fundamental threat to health systems, to global development, to security and economic well-being. The declaration places strong emphasis on strengthening health systems and ensuring equity in access. Equity in access not only to antimicrobials, but also to diagnostics and to vaccines. Importantly, it positions surveillance, robust monitoring, and transparent reporting as preconditions for progress and accountability in all sectors. So the capacity to make plans is almost being well surmounted now. And as we have been told, almost all the countries now in Africa have national action plans for AMR. We should congratulate ourselves. The next step is to begin to implement. But as we implement, it is important that we try from time to time to check on whether we are still on track. Now, capacity for being able to be on track also depends on the capacity to generate data. Capacity to generate data. We must reflect on that. Many countries, they have very weak capacities to generate data. And if they cannot generate data, then there will be no evidence to share. Our discussion today directly aligns with the priorities of the Global Leaders Group, which, among other calls for increased internal and external financing to support ambitious multi-sectoral national AMR plans, and also promotes evidence-driven progress reporting to global bodies. Monitoring and evaluation systems are therefore not just technical tools. They are strategic instruments for sustaining political commitment, unlocking funding, and building trust across partners and communities. In 2019, the World Health Organization Africa region experienced an estimated 1.05 million deaths associated with bacterial antimicrobial resistance, of which 250,000 deaths were directly linked to bacterial antimicrobial resistance. The African region has shown leadership from developing their national action plans to coordinating One Health structures. But we know implementation varies, and many countries still face limited capacity, and therefore we have weak data, fragmented data, and then of course there is insufficient financing to operationalize M&E frameworks. We also know that global partners increasingly look to evidence-based investment. So if you want to attract funding even, you then need to show evidence for why you need more funding. Therefore, strong M&E systems position African countries to meaningfully assess new financing opportunities and to make the case for domestic investment as well. The latest tracks data shows that while many countries have AMR national action plans, implementation remains quite limited. Only 41 countries report fully implemented plans with monitoring and financing in place. The findings also highlight the need to integrate AMR plans into broader national strategies to strengthen synergies and advance a practical One Health approach. I would like to emphasize three core priorities for us as we discuss in this particular webinar. One is the institutionalization of MR monitoring and evaluation as part of broader health system strengthening. The second one is to ensure data quality, ensure transparency, and cross-sector reporting, including leveraging all the global platforms that I had mentioned earlier. The third one is how do we link M&E evidence to advocacy and financial strategies? As we know, credible data is essential for mobilizing a sustainable domestic and global resources. And this is one of the priorities of the GIOG. We must implement, monitor, and continuously strengthen surveillance and measurement of resistant trends to assess and accelerate progress toward the global target of reducing AMR-associated mortality by 10% in the year 2030. I am confident that today's discussion will generate actionable insights and strengthen our collective resolve. Let us use this platform to advance transparency, to advance accountability, align our regional priorities, and ensure Africa continues to lead in the global AMR response. I want to thank you for your attention, but I look forward to a very productive session. Thank you.
Thank you, Professor, for highlighting how MNE drives transparency and impact, and for highlighting how robust MNE systems can transform AMR governance and accountability, and why countries should invest in it. Next, we will hear from our WHO colleagues, Pravarsha Prakash from WHO Geneva and Ernike Chow from WHO Afro, for insights from the 2025 tracks, especially Afro-specific reports, and the expectations for MNE under the revised Global Action Plan, which will be coming out next year. But before moving into that, I would like to let everyone know that we will be taking a few questions for the keynote speakers after this session. So please start typing in your questions in the Q&A. Now over to you, Pravarsha and Ernike Chow.
Thank you, and good afternoon, good morning, and good evening, everyone. Thank you again for this opportunity to present. I will start by basically providing a global landscape of current monitoring capacities and some data, but also importantly go into the Global Action Plan update as mentioned by Sharon. And I will then hand over to my colleague Ernike Chow, who will go deeply more into the data specific to the African region, especially data from tracks. So this was already mentioned by Dr. Chiku, so you all know about it. So this again might be repetitive, and a lot of you already know this, but just to remind everyone that when the Global Action Plan was adopted in 2015, it was accompanied by a global MNE framework that was developed jointly by, at the time, the tripartite, which included FAO, VOA, and WHO. And also when the Global Action Plan was adopted, countries agreed to develop, implement, and also very importantly, monitor national action plans. And to support the monitoring of the implementation of national action plans, the Tracking AMR Country Self-Assessment Survey was developed, and it's been administered now for 9 years since 2017. Just a little quick summary of the monitoring framework, because it is still relevant, although it will be updated in the coming years. Just to let you know that the monitoring framework was developed with the purpose to facilitate generation, collection, and analysis of data to assess the implementation of the Global Action Plan, and also, very importantly, to inform decision-making on AMR. And it includes 22 outcome indicators and 26 output indicators across all the sectors. It is multi-sectoral in nature, and the indicators are meant to be compiled at the country level through primary data collection systems such as GLASS, Animuse, Infarm, and of course tracks. But also a lot of the indicators draw on secondary sources that are already for which data collection is already ongoing, such as SDG reporting or global estimates of vaccinations, burden, etc. Just to mention now about the Tracking AMR Country Self-Assessment Survey, which is a very important component of the monitoring framework as well, and for which Ernike Chow, my colleague, will provide data from 2025. So this is a joint initiative from the 4 agencies now, so it includes UNEP as well now, and it is administered by WHO, but it is a self-assessment survey where countries can assess the progress of the implementation of their multi-sectoral AMR national action plans. And because it's multi-sectoral, tracks covers human health, animal health, food, agriculture, and environment sectors. And it is expected that relevant national authorities and technical focal points from across the different sectors complete the survey online. 9 rounds of the survey have been completed. It's been really encouraging for us to see a positive trend in response rate over the years and very consistent response rates as well. And because we really encourage countries to be able to use the data from tracks to identify gaps and also identify actions that need to be then followed up. And the whole point is that it helps decision making, not just at the national level, but of course, tracks data is also used for us to assess the progress of the action plan. And very importantly, it is also providing a evidence base for the current update of the Global Action Plan as well. We just launched the data for 2025 last week, so I do encourage you to have a look at the website, countryprogress.org. It contains data from 2025 and also the previous 8 years. It includes maps and visualizations, trends, and also country profiles that can be downloaded. So do please have a look, and the whole data set is also available for download. I just also want to remind everyone of this global landscape that's very important for monitoring, especially, of course, is that the UN General Assembly Political Declaration on AMR that was adopted last year includes a lot of targets for the first time. So, of course, you have one big target that looks at impact, where countries agree to reduce AMR-related deaths by 10% by 2030. But there are also targets on governance, which also includes that at least 60% of countries have a funded national action plan. And specific to human health, there are targets on 70% use of human antibiotics in human use that come from the WHO access category, and also that 90% of wash services in all health facilities meet the WHO minimum requirement for IPC. There are also targets in the environment, agriculture, human health sectors, and also specifically for MNE and related to tracks, 90 countries agreed to have a 95% country participation in tracks. And it is great that we've already met the target now for 2 years in a row, and we hope to be able to keep this momentum up as well. I will not go into details of why MNE is important. I think that was very well covered by Dr. Chiku, but Professor Chiku, sorry. But just maybe to highlight that we encourage when countries are developing their MNE capacities for the national action plans, then just to keep some principles in mind. Remember that like the National Action Plan is expected to be multi-sectoral in nature, it is very important that the MNE plans and frameworks that are developed for it are also multi-sectoral in nature. Given the current situation of resources being scarce, it is very important to also avoid the systems and capacities from being overburdened. So really look at what already exists and make sure to build on and consolidate already existing data collection and reporting systems. Another very important aspect to remember is that it is very important that the MNE function itself is also well resourced. You know, we talk a lot about having costed and funded national action plans, and we often forget that it's also very important that the MNE function is also well resourced, both in terms of financial resourcing, but also human resources, that there is someone specifically responsible for the MNE function who will be responsible for data collection, reporting, dissemination of the information, etc. And finally, remember to, of course, then is institutionalize these AMR functions to ensure sustainability, and so that then the capacities that you build for AMR can also be transferred to other programs. We, the quadripartite, propose an 8-step process for countries to go about developing an M&E framework, starting with looking at what questions should the M&E plan look to answer, and then identifying, of course, indicators, drawing on those that exist in the M&E framework, the global one that I just mentioned, but also already existing indicators that the country might be collecting data on. And then also importantly, like I mentioned, it's to decide on who would be responsible, what would be the governance for M&E, deciding on the frequency of reporting, how data will be collected. And then don't forget also, it's very important that the plan itself was also reviewed periodically, as the M&E plan should really be a living document so that the effectiveness can be constantly reviewed and lessons are captured so that revisions can be made as necessary. I'd like to take this opportunity to just highlight resources that we've developed in WHO. This is a 6-step process that comes in the WHO implementation handbook of how countries can go about developing and then monitoring the national action plans. So it starts with looking at governance, prioritizing activities, then you cost the plan, look at resource mobilization, implementing the prioritized activities, and finally, how you look at then how you monitor and evaluate. But these are not steps that are siloed. This is a very cyclical process that you constantly learn and adjust as required. Another important resource is specific to M&E is the quadripartite launched the guidance to facilitate monitoring and evaluation of AMR national action plans, and this also exists as a e-learning course. So this is really, I think, useful for national level implementers as a quick guide to how countries can set up M&E plans for their national action plans. Now moving on to the Global Action Plan update, because I think this is really important in setting the direction in the coming years. We will also update the M&E framework in line with the updated action plan. And so it is really important for everyone, I think, to take note now, because eventually if countries are going to also align their national action plans along the lines of the updated GAP, then it becomes very important to remember. So it's now been 10 years since the first Global Action Plan came out, and over the years, of course, we've seen some gaps that have been highlighted in the Global Action Plan, including the fact that many financing has always been an issue, including accountability that has come up as well today. There's been also limited integration of AMR into other existing frameworks and plans, such as the health sector plans or universal health coverage, etc., specific for human health. There also was an insufficient attention to the environmental dimension on AMR. And of course, sections on prevention, diagnosis, inequitable access, and R&D also needed to be strengthened in the current Global Action Plan. And therefore, the update now looks at a very similar goal, which is to preserve the ability to treat infectious diseases by ensuring safe and effective antimicrobials. But this one, unlike the first one, will be quadripartite. So it includes, it's a joint initiative from WHO, VOA, FAO, and UNEP, and it will be high level and promotes One Health approach. The updated Global Action Plan will look at driving multi-sector, but also sector-specific actions to implement evidence-based policies. It has a more strengthened focus on multi-sectoral AMR governance, which was really lacking in the first iteration, and promotes a prevention-first approach that is complemented with equitable access and appropriate use of vaccines, diagnostics, and antimicrobials. And also, importantly, it promotes sustainability through integrating AMR interventions in existing systems and agendas. And like I mentioned, it will be complemented by a revised M&E framework that will take into account the an updated list of indicators, but also the targets from the UNGA declaration. Just a quick outline of the changes to the objectives in the Global Action Plan. I think a lot of you are familiar with the 5 objectives, and this in the updated version, an additional one has been added that looks at the governance component. So really looking at strengthening multi-sectoral governance and financing and accountability. Additionally, each of the objectives have also been amended quite a little bit to fill in the gaps that were missing in the first iteration of the Global Action Plan. I won't go into the details, but just for example, now there is a more focus on behavior change in addition to just awareness raising, for example, in Objective 1. Also, just a reminder that the updated Global Action Plan that I'm presenting here, this is still in draft. Each organization is currently consulting with their member states as well. And so updates might be made to this presentation and to these objectives that I'm outlining here. And so just take this as a draft, basically. And then I think a new one will be sent to the World Health Assembly very soon. So the main considerations that countries need to take into account that then will affect the M&E components as well when it comes to this update of the Global Action Plan is that there is a increased focus now for countries to be able to cost their plans and then update their national action plans that's guided by the 6 objectives now, but also, of course, takes into account local context. There is, I think the first time around as well, but more so in this, there is a increased emphasis that all sectors and a One Health approach needs to be taken. For human health, don't forget to link to existing programs such as WASH, TB, malaria, etc. It is also very important, and I think this came out at the UNGA declaration as well, to involve all the stakeholders, not just across all the sectors, but also look at policymakers, the community, civil society, who will play very crucial roles in implementation and monitoring of national action plans. And specifically for human health, of course, it's important to not just look at across sectors, but also across different levels of care, from the community, primary to tertiary care. And importantly, we also hope that countries will then develop and implement their national M&E plans aligned with the updated national action plans. So I will just provide a very quick overview of some data. This is at the global level. So the GLASS report was just published, and we have data from 2023 that shows approximately 1 in 6 laboratory-confirmed bacterial infections worldwide are caused by bacteria resistant to antibiotics. So we see that resistance is actually most frequent in Southeast Asia and the Eastern Mediterranean regions, followed by the African region. So we can also look and we can say that there's actually a lot of disparity in terms of the regional data as well. Additionally, just going into the tracks data and coming more at output levels. So about 176 countries have a national action plan, but importantly for this webinar, only about 21% are effectively implementing and monitoring the plans with necessary financing. And also this year's tracks data shows that only 61 countries have adequate monitoring capacity and resources in place to collect data and also to have a real robust monitoring systems. And also only 58 countries then collect and evaluate data that's disaggregated by sex, location, income, etc. And of course, data disaggregation is really important for us to address inequalities in AMR. So this is why these areas really need to be strengthened globally. I will now hand over to my colleague Nikachu, who will give us more information specific to the African region.
Okay, Thank you very much, Prabharsha. Good morning, good afternoon, and good evening, colleagues. I'm Justin Nakacho, speaking from Brazzaville, in the WHO Regional Office for Africa. And now I will present the result of the tracks 2025 specific to the African region. Next slide, please. Great. So these slides show that the 9-year tracks participation trend in the African region. As you can see, participation has gradually increased from 27 countries in 2017 to 47 in 2025. So as you can see, for the 2 consecutive years, all our member states provide information, complete the survey so that this enables us to generate more comprehensive data so that it allows us to track progress and guide the planning and implementation of evidence-based interventions across the region. Next slide. So when we come to the status of regional status of AMR National Action Plan, it's already mentioned in the opening remark. National action plans on AMR are the first step towards a coordinated national response. So in 2025, all the 47 countries reports they have developed a national action plan on AMR, of which 14 have been endorsed by the national authority. This is corresponds to level B to A. So almost majority of the countries are endorsed by the national authority. The other thing, 38 countries, which accounts around 81%, are partially implementing their AMR national action plan with limited resource, which corresponds to level C to E. Overall, there is an implementation gap remains, with only 50% of countries fully implementing their national action plan with adequate financing. Even the previous year, 2024 data showed that there are no countries assigned domestic funding for AMR intervention. So when we see monitoring and evaluation, among the 47 countries, 90 countries have adequate M&D capacity, resource and mechanism across all sectors to conduct this monitoring and evaluation to monitor their progress of NAP implementation. And 60 countries reported they collect relevant data which are disaggregated by sex, geographical location, income, and other stratifiers, of course, which can help to identify populations that may be left behind and guide targeted intervention in the AMR response. Next slide, please. So in terms of integrating AMR national action plan with other existing national plans, as you know, integrating AMR NAPs with existing strategies and plans is very essential for a coordinated and sustainable response to AMR across the country. So 33 countries have linked their AMR national action plan to at least one of the following national plans or strategy, as you can see. Most frequently, countries reported they linked their national action plan with national health security, national health sector plan, and One Health strategy. Next slide. As you know, addressing AMR requires a One Health approach that brings together stakeholders from all relevant sectors so that to ensure effective governance and resource mobilization. The 2025 track result shows 45 countries, which is about 95% of our member states, they establish a multi-sectoral coordination committee or working group on AMR under the government leadership. So these accounts, these are countries at level B to E. So among this multi-sectoral coordination committee, only 29 countries report that they have a functional mechanism in place. That means with a clear term of reference, regular meetings, and also having a dedicated fund and defining reporting and accountability arrangements. In terms of sector involvement in multi-sectoral coordination mechanism, 23 countries that reported to tracks in 2025, they show that all One Health sectors involved in AMR multi-sectoral coordination mechanism. So as you can see from the slide, the human health sector involved in all countries that have already established a multi-sectoral coordination mechanism. And also encouragingly, the environment sector is also involved in 45 countries that establish AMR multi-sectoral coordination mechanism. Next slide. In terms of raising awareness on AMR, as you all know, education and awareness campaigns targeting specifically key stakeholders are very vital to promote responsible use of antimicrobials, as well as to reduce misuse and strengthening behavioral change. So this year, 17 countries, which account 36% of member states, have national AMR awareness campaigns that are implemented nationwide. So that targeting the majority of the stakeholders indicated by the green level D and E. When we see the trend, there are still some progress in the number of countries implementing nationwide AMR awareness campaigns since 2022, though there is a slight decline with this year response. Next slide. Next slide, please. Regarding legislation on antimicrobial use, 44 countries, which accounts for 90% of the member state reports, they have law and regulation governing the prescription and sales of antimicrobial for human use. And additionally, 42 countries, they have law and or regulations that ban the use and sales of substandard and falsified medicine. And also, more encouragingly, 21 countries have also law and regulation that ban the use of antibiotics for growth promotion in terrestrial animals. Next slide. So now we move to indicators which are specific to human health sector. When we see the training on AMR, specifically for healthcare professionals, of the 47 countries that responded to TRACS 2025, 34 countries, which accounts around 72%, report they offer at least some training on AMR. These are countries which are indicated in level C to A. However, only 2 countries systematically and formally incorporate AMR training into pre-service curricula for health workers. This is indicated by countries at level A. I think it's also important to note that there are still 3 countries that have no training for human health workers on AMR, and these are countries at level A. When we see the 4-year trend in terms of training on AMR, there is an increase in number of countries that offering some training and professional education on AMR. Next slide. In terms of national system for national antimicrobial use in humans, as you all know, monitoring antimicrobial use is it's a very critical component of national effort to combat AMR. So of the 47 countries reported this year, 17 countries, about 36%, they collect data on antimicrobial use, including data by aware categorization. However, as you can see from the graph, still 15 countries currently lack a national plan or system to monitor the AMU in the human health sector, so that there is a need to support these countries. Next slide, please. This slide shows the status of national AMR surveillance system in the African region. As you can see, out of the 47 countries that responded to TRACS 2025, 12 countries, which is about 25%, are collecting AMR data nationally, but still lack the coordination and standardization, which corresponds to level C. Encouragingly, 24 countries, around 51%, they now have a standardized national AMR surveillance system. These are countries which are reported as a level D and E. However, there are still 5 countries that have no capacity yet to generate or report AMR data. These are countries at level A. Next slide. In terms of clinical laboratory service, since 2022, WHO includes some questions to monitor laboratory capacity, including a performance on antimicrobial susceptibility tests for selected priorities. So based on this year TRACS response, a total of 44 countries, which accounts about 94%, report they have a capacity to perform antimicrobial susceptibility testing for some or selected critically important bacteria, with only 3 countries lacking such capacity. In addition, there are still 32 countries, which is about 68%, they report they have a capacity to perform antifungal susceptibility testing for important fungi, either to be Candida or Aspergillus or both. Next slide, please. And regarding the national implementation of IPC program, as you can see, majority of the country, which is 22 in total, have a national IPC program implementation in selected health facility. This is corresponds to countries at level C. However, only 7 countries, or about it's around 50%, are implementing IPC program nationwide, in line with the WHO IPC core component guidelines. At the same time, there are still 2 countries without a national IPC program or operational plan in place, so that there is a need to support those countries. When looking at the trend over the past 4 years, we can see that there has been only limited progress in expanding nationwide implementation of IPC programs. Next slide. Next slide, please. Regarding so this slide focuses on optimizing antimicrobial use in hospital. This is the newly introduced indicators. So the result shows that still 23 countries have a guideline in place, and antimicrobial stewardship program are implemented in at least some healthcare facilities. These are countries that corresponds to level C to E. However, still there are 11 countries that have no or weak national policies to promote appropriate use of antimicrobials, which include aspects related to availability, quality, and disposal. These are countries which are at level A. Next slide. These slides also show that the AWARE classification adoption in the region. As you can see from the graph, all 47 countries now, they have information on AWARE classification of antibiotics, because level A shows 0, which means that there's no country without knowledge or information on AWARE. So currently, 36 countries, which is about 76%, have integrated this AWARE classification into their national essential medicine. When we're looking at the 6-year trend, as you can see, there has been a steadily increasing number of countries adopting the AWARE classification. Next slide, please. Good. So now I will hand over to Prabharsha for the final conclusion. Over to you, Prabharsha.
Thank you very much. I won't, I think, take up too much time. We're already running over, but just to say that there are some, I think the data shows critical gaps that need to be addressed, and that is the whole point of data as well. So again, thank you for the opportunity, and we will remain for any questions.
Thank you, Pravarsha and Yirnika Chow, for that very excellent presentation, crisp. And also I would borrow a word used by one of our participants, very instructive presentation. So thank you so much. We are very mindful of about our time. So we will probably take 2 or 3 questions. Rest of the questions, if the panelists, if they can answer directly, that will be good. So first question, I probably may direct it to Pravarsha and Yirnika Chow. What does it is from Hassani Chawla? What does it take for a country to have a robust AMR monitoring system, especially for countries that mostly have paper-based client monitoring tools with few facilities using electric medical records for patient monitoring?
Yeah, I can start, and maybe Yirnika, if you want to come in. I think that's it's a very important a very important question and a very important point to note. I think this is what I meant by a lot of countries still lack the required financial and technical resources required for M&E. I would perhaps just guide countries that yes, there is a lot still done on paper, and the information systems still need to be strengthened. However, in the meanwhile, I think starting with just looking at how the implementation of the national action plans can be monitored, even at an input and an activity level, is a good start, so that you can look at what resources you have spent, how much remains, what gaps, and then when your systems are strengthened a little bit more, then look at more outcome or maybe even output level indicators. But at the very start, it is important to just look at some key inputs and activities that can be monitored, and then look at how you can collect data at the outcome level. And this is, I think, a lot of times people think M&E plan is separate from all the activities done in the national action plans, but it's not true, because if you're strengthening your surveillance system, if you're strengthening your monitoring system for antimicrobial use, for AMR, all of that is then generating data that can be used for the M&E plan. I don't know if Nikachu wants to add anything.
Yeah, I think you mentioned right. Yeah, so the most important thing I can say is, there is data at ground level, and it's very important to leverage existing tools that capture data at primary healthcare level. For example, some countries, they have the DHIS tools that capture some of the information. So it's also important to think how to leverage those existing tools at the country level. Thank you.
Thank you, Prarsha and Yetnika Chow. Probably the next two questions I may club and direct it to Professor Chuku. From an anonymous attendee, 93% countries reported legislation of AMU use. Is there any monitoring on the functionality of this legislation? I believe having legislation in place is not enough. Are they put into action? Along with that, why countries lack standardized capacity? Isn't it possible to build the capacity? Professor Chukubu, do you want to take that?
Yeah, thank you very much, Sharon. Yeah, those questions are very relevant. I'll start with the second one. Is it possible to build capacity? Yes, but that is where we need a lot of support, particularly from the external sources. The reason is simple. Politicians who win elections to govern the countries where you have democracy. Part of the problem of democracy is this thing called election. So most often, democracies end up just being cycles and cycles of elections. And for people feel they have to win elections by putting what they call tangible projects. So you can build a block, or concrete block somewhere, label it a hospital, and you commission it, and people are impressed. Straightening data collection is rather intangible. People say they can't, rather it's also expensive. So people find it difficult to commit funding. So we may leave domestic funding for most of these so-called tangible things, while external funding can help us do the intangible things. So it is possible to build capacity, very, very possible. And it doesn't have to be in silos. It's part of the overall strengthening of the health system in that country. Such surveillance system covers the full gamut of healthcare. It's not only for AMR, we must emphasize. First question had to do with those legislation and whether, having legislation is a beginning, just like having national plans. It's a beginning. But it's more important to see that this piece of legislations are being enforced. So the M&E framework will help us to answer those questions. So those are questions that appear on the dashboard. Do you have a law? Yes. How far have you implemented the law? So that way, the countries are being forced to know that they have to implement the law. So it's not enough to have legislation. It's more important to enforce those laws. Thank you.
Thank you, Professor Chukubu. Unfortunately, we are not able to take more questions, but speakers, I would encourage speakers to type in the answers directly onto the Q&A. And I can also see some questions, people raising hands, but because of short of time, we will not be able to take direct questions as well. Please put in your questions in the Q&A. This webinar is live stream, so you can always go back and watch in our YouTube channel, React Africa YouTube channel, that is shared in the chat as well. Now we have to move ahead. Thank you, the keynote speakers, for the thoughtful responses, and also for setting the solid foundation for the discussion ahead. Next is our panel discussion, which is titled Building Effective Monitoring and Evaluation for AMR NAPS, African Experiences and Lessons. And I have the honor of moderating a distinguished panel of experts who bring diverse experiences from regional, national, and partner perspectives. Please join me in welcoming our panelists, Dr. Ali Yahaya, AMR Unit Head, WHO AFRO, Dr. Emmanuel Tanui, National AMR Focal Point, Kenya, Mr. John Lakeman, Senior Program Advisor, Monitoring and Evaluation and Learning, ICAS, and Dr. Lauren Janklowitz, Access Lead, Sub-Saharan Africa, GATP Africa. We will each will have a maximum of 7 minutes for their reflections. So we can start with Dr. Ali Yahaya, who will speak on regional priorities of for MNE capacity building in Africa. Dr. Yahaya, please go ahead.
Thank you very much for this important session. And in line on what so far my two colleagues have mentioned, I would like just to emphasize that the regional priority for MNE in our continent is really turning around planning, human resource capacity building, data collection tools, as well as the use of information for decision making. I would like to highlight that in terms of planning, it is really important to have a dedicated MNE plan within the National Action Plan. This will allow us to avoid some gaps that we have notified in some countries, and among the gaps is related to not availability of baseline data. In terms of human resource, definitely having skilled MNE focal persons or team is important, and identify those skilled MNE focal persons is really needed, and this will also be further enhanced through establishment of functional multi-sectoral platform. Data collections tools is very important. It is true that some countries may have digital tools, and this could help them to quickly collect the data. And it is important also that they further enhance this area, for example, by having standardized and harmonized approaches. This will promote regular monitoring and evaluation of the progress so far conducted. And in terms of evidence generation, as I have mentioned, it is important that countries continue to use the information for decision making. This will help them for prioritization as well as strategic funding. And I would like to highlight that we as regional agencies, specifically the strong collaboration between at regional level between the quadripartite, FAO, UNEP, and the WHO, we try as much as possible based on the country request to really engaged in the process of the NAP design. This will help us really to be able to better support countries. And we convince the member state to ensure alignment, considering guidelines that are already available. This will further enhance MNE process, and it is also needed to consider joint advocacy and capacity building, and colleagues have mentioned about that. And why not? This capacity building should be done across sectors through a strong multi-sectoral coordination and collaboration. And my last point, it is also to continue to engage our member state to honor the MNE process, and also to ensure accountability in terms of reporting and the use of data for evidence generation. Thank you.
Thank you, Dr. Yahaya. Now we will move on to our next panelist, Dr. Emmanuel Tanui, who will share country-level challenges in developing and operationalizing an AMR MNE framework and possible solutions. Dr. Tanui, over to you.
Dr. Tanui, you're muted.
All right, thank you so much. Yeah, so as I'd mentioned, my name is Dr. Tanui from Kenya. I work at the National Public Health Institute as the AMR focal point. And I just wanted to share our experiences that we underwent as a country in operationalizing our M&D framework. And just as an introduction, before delving into our challenges, we have seen that majority of the countries have actually gone ahead to develop their own national action plan, and less than half of these countries have fully functional M&D systems. And the challenges really show that in as much as these countries have the will and the policy intent to be able to implement these, I think the challenge is having fully functional systems. So we developed our first national action plan in 2017. However, our challenge from the word go was the fact that we were not able to develop our own M&D framework concurrently with our national action plan. In fact, our national M&D framework was developed 4 years after the first national action plan. And we were able to see some of these challenges when we were doing our end-term evaluation of our national action plan, and you could see that we were able to only implement about 40% of the activities, or rather 30%, with about 40% still ongoing at the point at the time when our national action plan had ended. Almost 30% of those activities we were not even be able to implement. So based on these, when we were actually developing our second national action plan, we did this concurrently when we are prioritizing our activities. We were able to outline specific indicators to be able to track implementation of these interventions and activities, clearly assigning where responsibility and at what frequency these were going to be implemented. Of course, we saw the challenge that we were undergoing in the first phase in terms of being able to report these activities all the way to the national level. We tried as much as possible to leverage on technology so that we can be able to get these indicators being reported nationally in real time. So despite all these plans, of course, there are challenges that we encountered during the process of operationalizing our compare clearly the data from the different sectors, because the different sectors collected data in different systems, and there are different paces and capacities. We also had difficulties in terms of collecting data because of the weak technical capacity. We do not have dedicated M&D personnel to be able to collect these data, in as much as we were able to undergo limited training, but that did not overcome some of those M&D challenges that required dedicated units. There also the challenge of budgetary lines, because M&D process requires a lot of resources and time. The fact that we did not have a dedicated budget for M&D meant that we were not able to have a seamless M&D process. The other challenge as well is some M&D indicators are very complex, where being able to determine the denominator is one of those big challenges. So it meant that some sectors could not be able to collect some parameters, meaning that reporting was one of those challenges. The issue revolving around financing is one area that cuts across the different challenges, and we think that if most countries are able to dedicate finances for implementation of the National Action Plan as well as the M&D, we could be able to solve a lot of these challenges. So based from these experience and challenges, what is it that we were able to learn, and we are actually recommending other countries to think about? The need to be able to develop the M&D system and the National Action Plan concurrently, do the reviews at the same time, so that you can be able to effectively monitor. The presence of a coordination mechanism, a governance structure, is very critical, so that you can be able to coordinate implementation very seamlessly. Integrating your AMR indicators into existing health information systems is very important for sustainability, and also utilizing existing government M&D systems can ensure that you do not require a lot of resources. Leveraging on existing structures, I think these have already mentioned, and it's related to what is structures that have already been established by different sectors. Finally, the key insight that you're able to learn from this process is that for you to be able to do successful M&D, you require that you coordinate both policy and operation, so that you can be able to ensure that you collect accurate data, you're able to sustainably operationalize this process. Thank you very much.
Thank you, Dr. Tanui. It's valuable to always hear from country focal points who navigate these challenges firsthand. Now, let's hear from Mr. John Lakeman of ICAS, who brings a resource partner's lens on evidence-informed and M&E approaches. John, please go ahead. John, if you're speaking, you are muted.
Hi, sorry for the delay. Yeah, so thanks very much, Sharon. Yeah, I'll just give my few reflections here on behalf of ICAS. Very pleased to be part of this webinar. It's addressing a critical issue, both in terms of implementing AMR plans at national level, but also the critical issues of supporting those plans with M&E systems that support implementation with credible evidence on performance to develop strategies. So I will give my perspective from both the perspective of a practitioner in M&E, and also, as Sharon said, as a representative of a resource providing organization to the AMR sector. So first, the M&E practitioner perspective, and I think the thoughts here align very much with the thoughts provided already by the different presenters. I think first to draw your attention to the framework on the right. I was reminded of this as I was going through the materials preparing for the webinar, and this is a framework I've often referred to in different trainings and capacities. But it's originally developed by UNHIV and then has been developed over the years and adopted by the World Bank. So the link you see at the bottom refers to the World Bank resource. And it's an extensive resource which I would recommend to anybody working on M&E systems. But the framework, I think, itself is useful conceptually. And I think there are a number of ideas that are useful for us there. Firstly, that M&E systems can be considered a jigsaw of different components that we need to have in place to work well. Also, that when you look at the blue components on the inner circle, these are the more technical M&E components, looking at data collection, evidence generation, data management, which you often think of when you think about M&E systems. But what you don't often think about are the green components on the outside, and these are the softer, less technical issues which are often essential to making an M&E system work. And there you see the idea that it's important to have the M&E plan. It's important that the M&E plans are costed and that there's people in place to ensure the implementation of those. So I think that the presentations are already given present those ideas very well. And of course, all of it is about generating evidence and data that can be used for decision making. And it's really important to have that focus. But then also some more personal, more pragmatic reflections on M&E system design. And again, there could be many more, but I try to keep it quite focused. The importance of relevance, the right data at the right time for the right people. Setting up systems that can do that is of course very challenging, but that's so important to keep focus. Right data. I think the key to that is, like we heard before, having the M&E plan that helps identify the questions and the data points that we want to collect in health systems and country level systems today. There's often so much data that's out there. Having the plan and the strategy helps focus it right down to what's essential. Helps prioritize. And in terms of right people, there's usually more than one stakeholder that needs to benefit from an M&E system. Often in this case, the international organizations, we need to be able to report up on particular indicators, but we also need to be able to speak to our own context. And that's where having a good understanding of the different information needs at the different levels is important. And for that reason, I say it's important to align upwards. It's important to look at what the data requests are from other stakeholders, but also to look downwards and to look at what exists already in your health systems, in your national data collection processes. And that's where maybe where AMR has a particular advantage as a cross-cutting issue. I would expect it's quite likely that the different institutions would be collecting some relevant data. Maybe it's not 100% aligned with what we need, but if we could make use of that data rather than collecting additional data, then that would be a quick win. The third point, be proportionate, is quite often to specify a percentage of the overall budget relevant for M&E. And that's important to make sure that we're not spending all our time collecting data and filling in forms as opposed to actually implementing the plan. And there, where you're starting out in terms of developing a system, it can be also important to start small. For us here in ICARS, we're developing an M&E system right now, and we're starting to pilot some of the indicators with a smaller group of projects rather than trying to expand and scale up immediately. That gives us the opportunity to learn and to test what works before expanding it across our entire portfolio. And then finally, adaptiveness. This is about making sure that the data has practical use. It's already been mentioned. It's also about making sure that the different stakeholders have different opportunities to use the data. There may be different reports and the timelines associated with those. There could be other policy level decision making processes which the data needs to feed into. And for it to feed into it effectively, it's about packaging the data accessibly. So processing the data that's collected, making it available, making easily available for different stakeholders to get access to it, but also providing analysis beyond the initial headlines to make sure that it fully tells the story of the data behind the different indicators we're working with. And then finally, just to give more of the resource partner perspective, and particularly from the point of ICARS, where we as an organization, we have sustainability at our heart. Our approach to working with country partners is very much embedded in the ideas of sustainability and One Health. And part of working with our projects is always about this co-development process where we work closely with the national partners. And that's because we believe that for projects to be sustainable, it's important that these are embedded and owned by national capacity. And again, particular to the One Health agenda, we need to be looking at beyond one particular sector, working with human health, environment, animal production. And that means working with different institutions nationally, different data collection processes, but making sure that it's joined up. And there again, there could be opportunities for relying on an existing capacity, given that those institutions probably have data collection processes already. Our perspective on M&E, I think it's important that M&E tells a story. We often hear about outputs, outcomes, and impacts. And very often the M&E systems are directed towards output level data. That's the data that we can get easily. And that's also, of course, also important. But it's also important that we're able to look beyond that and understand what effects the actions we take if had as an effect. And neither outputs by themselves or outcomes by themselves can tell the full story. It's about all of these things together. And finally, we of course want to see that the data demonstrates progress. That's nice, but we also know, and we're realistic in understanding that that's not always the reality. So where there's a story behind the data, I think as a resource partner, we'd also like to hear that, even if it means looking beyond the headline, beyond the average. What are the things that are more challenging that the data tells us underneath the headline? I'll stop there and hand back to Sharon. Thank you again for the opportunity.
Thank you, John, for bringing that perspective, especially focusing on sustainability, ownership, and realistic approaches. And finally, we will hear from Dr. Lauren Janglowitz, who will highlight identifying funding opportunities for strengthening M&E, leveraging from her GARDP experiences. Dr. Lauren, the floor is yours.
Hi, everyone. I am Lauren from GARDP, and I'm going to talk just very briefly using one example of a program that GODP does, where we work on the development of multi-stakeholder coordination platforms. In our case, these are stakeholder platforms that we create together with countries in order to look at the introduction of reserve antibiotics into those countries, and how best to introduce these antibiotics and sustain the introduction and steward the introduction. But these stakeholder coordination platforms can be leveraged to integrate M&E into existing health system investments and to access funding. So there are a number of thoughts, and the first is to not only see the platform as limited to, in our case, the introduction of reserve antibiotics, but to recast the platform as a systems integrator. So instead of being like a meeting organizer, to be a system integrator, where the mandate is to translate the AMR data that is being collected into real decisions, decisions for procurement, decisions for clinical guidance, decisions for financing, to then use the platform to create shared deliverables, that it doesn't have to only focus on the reserve antibiotics. It can focus more broadly on what is it that the country needs and how to utilize, in our instance, the introduction of reserve antibiotics to create these shared deliverables and shared ways of accessing funders, to make these deliverables the platform's currency, so that funders invest in the actionable data that the M&E produces. Then to align AMR M&E with existing health investments and systems. And this really involves using what already exists, strengthening what already exists, rather than reinventing new systems. And particularly when there are multiple partners working in countries, to make sure that as each new partner comes in, they don't invent a new M&E system that then targets new data and is presented to new funders, and rather that there's a way of collating and sharing the data and strengthening from what already exists, to create a single view or a single source of truth. And like colleagues have said earlier, this involves agreeing common data standards and indicators. So, for example, using GLASS as an example, and making sure that the M&E data collected through various platforms and various projects meet the country needs for the data being collected, and then that data becomes currency. To drive accountability through policy and funding levers. And really what this means is it means linking the M&E outputs to concrete actions, to places where there are real supply gaps, to where there's rising resistance, where there are stewardship gaps, and so on, and then to link it to budget allocation, to embed One Health and cross-sector representation, so ensuring that all sectors are represented in the gathering of data and the putting together of the proposals that come from that data, and finally making the platform a convening engine for capacity building. So again, not reinventing the wheel, but hosting joint training and pooling resources, so that the M&E strengthening actually strengthens the institution, and like John mentioned a little earlier, creates sustainability and sustained capacity. Thanks very much. Over to you, Shireen.
Thank you, Lauren, for that valuable insights regarding why M&E outputs should convert into actionable points and the need for harmonization. So thank you all, our panelists, for those insightful contributions. We have heard rich examples from policy to practice and from evidence to financing. Now we are moving into our interactive Q&A session. We will begin with a few guiding questions for our panelists before turning to the audience. In the meantime, Please start putting down your questions for the panelist in the Q&A. And if you'd like to direct it to a specific panelist, feel free to mention their name as well. So we will start now with Dr. Ali. Dr. Ali Yahaya, could you share an example of a successful regional initiative, perhaps at a country level, that has effectively strengthened M&E capacity for AMR, and what specific factors made it replicable across different country contexts?
Thank you very much. I'm sure that there are several examples, but I would like to highlight specifically regarding our regional quadripartite, of which we have a strong initiative where FAO, WHO, OA, and UNEP, we are working together to support countries, for example, Ethiopia and Namibia, in developing the AMR MNE plan. So there are several success factors, but I could highlight key of them. The first one is related to a strong multi-sectoral coordination mechanism. This should be not only at a regional level, but also at a national level. And as I have mentioned previously, and because other colleagues have also highlighted, the availability of standardized tools aligned with the global frameworks in the spirit of One Health approach is very important. And also countries need to continue regularly update the national country profiles using, for example, the Trax platform that has been mentioned. And we also see that accountability of member state in terms of reporting, for example, through the regional committees, World Health Assembly, and why not in the future meetings in UNGA will be really an important momentum where the added value of M&E is needed. Thank you.
Thank you, Dr. Ali, for those valuable insight. The need for updating and also the need for accountability from the countryside. And now I will move on to Dr. Emmanuel. Dr. Emmanuel, beyond technical capacity building, what incentives or governance mechanisms or cross-sector coordination practices have been most effective in sustaining participation from human, animal, and environment sectors, particularly when reporting obligations compete with other national health priorities?
Yes. Thank you very much. Sorry, I didn't get the question. I think my internet was not very good.
Sorry, I'll repeat the question.
Yes.
So, based on your experience,
Mhm.
what is the most effective way in sustaining participation among One Health, particularly when reporting obligations compete with other national health priorities?
All right. Thank you very much. I think that is very good. First of all, the issue of having functional governance and accountability structures is very good. AMR coordination is embedded within existing One Health structures. For example, at the national level, we have the National Antimicrobial Stewardship Interagency Committee and the County Antimicrobial Stewardship Interagency Committee at the sub-national level, so that whenever AMR reporting is done, it is done according or rather alongside other performance target. We ensure that whenever CASIC functions or activities are being implemented, they are being carried out together across the different sectors. So our governance and coordination structures are truly One Health. Secondly, the issue of cross-sectoral collaboration and communication is very important. For example, conducting joint AMR data review meetings is very important so that you have clear understanding across the sectors on why this data is being collected, what are the challenges or the gaps, and how you can be able to address them collaboratively and collectively. A response, for example, to regional and international a request for data submission, for example, tracks. This is important to be carried out as a country collaboratively across the sector so that you foster teamwork, you are able to strengthen the One Health approach, because some of those responses require that you evaluate the work done across the different sectors. Thank you very much.
Thank you, Dr. Emmanuel, for highlighting that the inter-sectoral coordination is very, very important. Now moving on to John. From a funder's standpoint, what are some practical ways that countries can present data or results to demonstrate accountability and attract continued or increased investment in AMR programs, specifically to its M&E systems? I know that sometimes examples related to M&E as such is difficult to get, but if you can highlight a few. Over to you, John.
Sure. Okay. So thanks for the question, Sharon. I think to answer the first part about practical ways to present data, I'd refer back to my presentation, and I think the idea of presenting the story presented by the evidence. M&E systems are often very much focused on indicators. These provide us with data points, but to actually communicate the story to the funder, it's often about breaking the story down a little bit more and presenting it alongside accompanying analysis, which explains the data in context. So I'd encourage that from a general perspective of how to present data, and that can be in terms of, like I said before, presenting the outcomes alongside the outcomes, and using that to tell the story. But it can also be about presenting qualitative data alongside quantitative data, which present different kinds of evidence in context. So quantitative measurements often tell you about the change. Qualitative data often gives you the background and explains the how and why behind it. And similarly, different indicators can mean very different things in different contexts. So that's something about the context and what it means for your context, alongside the data that's being presented, I think is very helpful. But then in terms of how M&E systems can attract funding, I think from my experience, you don't usually see funding for M&E systems separately from program funding. It's usually a component of a particular grant or a particular funding, of which a proportion is set aside to do M&E. But that's where M&E plays its role. It plays a role of providing more credible evidence on how the program is working, and its achievements in a way that presents the results to external funders, and most likely attracts funding over the longer term. I think the evidence on this is tentative too, but I think there are studies out there that show that the better functioning the M&E system, the more likely programs are likely to attract funding over the years.
Thank you, John, for highlighting the importance of storytelling. Now I'll move on to Dr. Lauren. Dr. Lauren, based on your experience, how can countries practically engage non-traditional partners like private sector, academia, or regional development banks to co-finance or integrate AMR, MNE into broader health system strengthening initiatives?
Thanks for the question, Shireen. I think that this is where the data is important, that if there is strong and coherent data that tells a convincing story, that different kinds of investors and donors can be engaged with and are often very interested in supporting processes. I agree with what John has said, that it's very difficult to fund M&E as a standalone, but certainly to fund a program where the M&E is used to demonstrates why it would be an important program to fund, that is often very, very convincing. So it would start off with strengthening the data systems and gathering the right kind of data, and then getting some support in terms of telling the convincing story, and then identifying the different donors, particularly those that are performance oriented, that are performance funding oriented. And an example of a donor there in TB, HIV, and malaria was the Global Fund, that they really took the actions that were delivered and used those actions and the data that proved the actions to continue to fund or to fund further. And so one can use a similar kind of philosophy that countries know how to do and have done successfully in the past within HIV, TB, and malaria.
Thank you, Dr. Lauren. Often M&E is looked at as, increasing the paperwork, but as you have mentioned, if you can bring out the findings of the M&E can be used to highlight the impact of the project, I guess that itself is the right start. Now we will take questions from the audience because we are running short of time. I will probably start from Dr. Bernard. He has a question. I was happy to learn the experiences of NAP MNE from Kenya. I am from Tanzania and we experienced similar challenges, include delays for MNE after missing this part in our first NAP. Our main worry is how best we integrate human health, animal health, and environment to concrete and meaningful evaluations under One Health agenda. I would probably address this question towards Dr. Ali Yahaya. Dr. Ali, do you want to take that?
Thank you very much. If I understand the question, that although the countries they are establishing multi-sectoral collaboration, but still the M&E part of it may need more strong collaboration between various sectors, including human, animal, and environmental sectors. We have this opportunity that countries, all the 47 countries, they have the National Action Plan to address AMR. In the majority of the countries, this plan incorporate already the M&E part of it. So what is important is really ownership at country level, and also why not to find a mechanism to build the capacities of the team at all levels, so that M&E focal persons can be able to really engage not only at human sector but also at various sectors. And it is also important to use data for prioritization and research mobilization. This will allow various sectors to gain benefit from M&E in order to overcome working in silos. So those are some tips that we we might need to consider. Thank you.
Thank you, Dr. Ali, for highlighting the importance of country ownership, resource mobilization, and capacity building, and also not to work in silos. Thank you for that. I will now move on to Dr. Emmanuel. There are two questions addressed towards you. One is from Gaundensia. Hi from Kenya. I'm an MPA student and would like to ask Dr. Tanui, given the central role community health promoters play in informal settlements, how can MNE frameworks be adapted to measure and improve their antibiotic-related knowledge and practices? There is one more. How do you aggregate and combine data from county and sub-county into national One Health joint data? This is from Dr. Bernard. Over to you, Dr. Tanui.
All right. Thank you very much. I think those are very thoughtful questions. I'll start with the one from Gaudensia. So in Kenya, the community health promoters are really the backbone of service delivery in informal community setups. And we know that these setups are where there's a lot of antibiotic misuse, such as self-medication, incomplete doses, and so forth. So for me, one of the ways we can really leverage on the CHPs is integrating AMR indicators into their community level data tools. We have what we call the Kenya Community Health Information System, the ECHIS, and here the CHPs are able to report on, for example, how many households they've been able to assist, and we can integrate here AMR indicators, for example, if they've been able to cancel any household, or they've been able to report any adverse reactions or self-medication cases. These, I think, are ways in which you can integrate. The other is there are instances where we've been able to conduct maybe dialogues, community dialogues. So CHPs themselves can be part of these M&E process of being able to collect data, maybe recording the reflections and feedback from the community on these dialogue days. The other is for them actually being able to conduct any surveys, if you're conducting any surveys on knowledge, attitude, and practices amongst the community, they can play a very key role so that we can know what are the gaps around the practices in the community, and where we can be able to influence behavioral change. Going to the second question by Dr. Bernard Mwele, on how to aggregate facility data, and even at the sub-county and the county level for you to be able to report. So as I'd mentioned, we have AMR registers for us as a country that we developed together with the counties, focusing on laboratory surveillance, antimicrobial consumption and use at the outpatient as well as the inpatient level. And we went ahead to train some of these facilities. So the facility can be able to utilize some of these registers that have been digitized, sending to the county level and the national level. So at the county level, they can be able to aggregate data from different facilities and share the data to the national level, where we aggregate the data at the central data warehouse. So you can leverage technology to make this process very seamless. Thank you.
Thank you, Dr. Emmanuel, for giving those practical suggestions, how to adapt M&E to a local context. There is another question here. How sustainable is a standalone global M&E framework for AMR like TRACS? Instead of focusing on primary data collection every year, can we focus on derived data from other global systems like WHO, UNICEF, JMP? But I feel that either Pravarsha or Yirnike Chow probably maybe best place to answer that. So I would encourage them to type the answer directly there. So that's then the other question that is left is probably an idea that is given to React Africa itself to start any courses on M&E, which, yeah, that thank you for that idea. That brings us almost towards the end of today's webinar. Thank you for all the excellent questions put forward by the participants and also for the thoughtful responses. Thank you everyone for such an engaging discussion. It is encouraging to see the energy and interest around MNE strengthening in the region. So as we are moving towards the end of today's session, I would like to sincerely thank all our speakers, panelists, and participants for making this such a rich dialogue. To wrap up, I'm pleased to invite Dr. Tracy Muraya, Deputy Director, Policy and Strategy, React Africa, to share closing reflections and the way forward. Over to you, Dr. Tracy.
Hi, everyone. Sorry, there was a lag in my system. Yes, thank you so much to everyone, to the audience that has been patient for almost 2 hours, and even quite engaging, just asking our panelists and speakers the questions. So mine is, as Shireen has said, a very easy task to thank the speakers. I want to even just start from our executive director at React Africa for providing us with a platform to give the opening remarks, followed by Professor Chukwu, I hope I pronounced that right, who also, and there's something I took home from Prof. Chukwu, and I've always been asking myself as well, and perhaps even in some platforms that we engage in, should our leaders actually be given a tool that they are able to go and present to their peers. So for instance, how we see when it comes to monitoring the Sustainable Development Goals, they have voluntary national reviews that they actually go and present to their peers. So what M&E tool should we actually look at and look for to feed our ministers with, even as we look forward to next year's Abuja high-level meeting on AMR. I also want to thank Prakash and Yudne Kachu, who we've worked with in the past, actually, for bringing in a very insightful presentation, for Pravasha giving us the overall outlook and really showing us where we are as a globe, and then Yudne Kacho bringing in the African context of things. And if there's something that your presentation, including that also from Dr. Yahaya at now the Afro level, is to encourage us and to really, make us question, where are we as countries? We've already been given the key guiding principles for monitoring and evaluation for AMR NAPS, because what is measured is what gets done. But even as we go ahead as countries, what has come out from the WHO perspective especially, apart from showing us the progress and also the challenges, is that if we're putting robust and comprehensive M&E frameworks in place as countries, they need to be multi-sectoral in nature. We need to avoid overburdening our systems, because really less is more, right? Then more importantly, perhaps for many of us, allocate resources for the M&D function, but we've also heard from our funders that this will not be given sort of, a single check. It has to be integrated within the actual programs themselves. And that is why then we need to institutionalize AMR, M&E functions within existing programs to ensure sustainability and build country capacity around them. We got an excellent presentation from Kenya as a case study, if I may put it that way. already highlighting right from the beginning, as Dr. Tanui said, that perhaps what they saw as, you know, a lesson for them and what they would encourage other countries not to do is not to work separately. That is not to, for instance, update our existing national action plans and then after a few years look at the M&E plan. But this should go hand in hand, because it is only then that you're able to actually compare oranges and oranges vis-a-vis apples and oranges. Of course, then we had from our partners and funders at ICAS, John Leckman, thank you, Lauren Yankelowitz from GADP Africa, who really brought into perspective the need for us to, even as we're investing in robust M&E systems, we need to give them the story. We need to give them convincing yet comprehensive stories that they are able to plug into, and more importantly, adapt to the data needs of the different countries or regions or even local situations that they come into to support, so that then we are actually able to even sustain our reporting into the overall platforms, the global platforms that are being fed in from our local platforms. So with that, ladies and gentlemen, even as we anticipate the World Antimicrobial Awareness Week activities that are commencing next week, with the theme to act now so that we protect our present and secure our future. And as we also say at REACT, to have a world that is free from untreatable infections, we implore that there's more engagement from all sectors so that we have coordinated mechanisms, not only just from the One Health traditional perspective, if I may put it that way, but also involving private sector, academia, civil society, so that overall we are able to meet the laid down targets and goals. So thank you so much. And with that, I hand back to Sherin. And Sherin, sorry, I forgot to thank you. So thank you, Sherin, for an excellent moderation. And thank you for my colleagues who are in the background, the IT guys, the communication guys. Thank you ever so much. Thank you.
Thank you, Tracy, for those kind words. And that brings us to the end of this particular webinar. Thank you all for participating. And also I want to thank the team behind this webinar, Olen and Gift, who was supporting me in this. Yeah, thank you all and have a good evening.
Thank you.
Thank you.